Health Minister Dr. Bernard Okoboy has dismissed assertions that the government is eager to complete hospital projects in the Ashanti region for political gains. The minister, who is touring the region, says the government will see to the completion of the Swami and Syria hospitals by September this year. According to him, the projects started years ago are critical to improving universal health coverage in the country.
For years, the government has been under intense pressure to complete some health facilities under construction in the Ashanti region. The health minister, Dr. Bernard Okoboy, on a tour of the Ashanti region, has been given deadlines for commissioning of some projects.
I had to read this to remind all of us that good things don't happen in a day. They happen over a period. And this reminder is important because we are in an election year. So that if you see a facility like this being commissioned in September and God willing in October, people entering to have access, remember that it was birthed or conceived way back in 2020.
The Sewa and Swami hospitals are scheduled for completion in September. Under the Vamed Hospital Projects, 12 hospitals were to be constructed in 4 regions. The €71.5 million contract, awarded in August 2020, was to be completed in 24 months, but has been delayed due to domestic debt exchange program. 5 of the facilities under this project are in the Ashanti region. At the Swami Hospital, civil works are 95% complete as medical equipment installation reaches 70%.
And by the way, all this is outside Agenda 111. Sometimes the impression is created that Agenda 111 is now coming to add health facilities to our stock. Many health facilities have been worked on by this government. Agenda 111 is only coming to complement all that we've done. And by the way, this facility is the typical model of a very fit-for-purpose primary health care facility. When we say primary health care, the basic things that a community will require.
Poor road network to the hospital may affect operationalization of the facility, but the minister has committed to an upgrade of the roads. The Director General of the Ghana Health Service, Dr. Patrick Kuma Abuaje, is upbeat about the contribution of the project to the universal health coverage.
We are doing about 50% according to UN system data. 50%. But the greatest challenge we have is what we call the peri-urban areas. It's the peri-urban areas who live in the towns but they don't have access to care. Because if someone lives here in the morning to attempting to go to Konfanochi or anywhere, it takes them such a long time. So bringing such a facility within that community is really something that is going to be very helpful to make people access care more easily, and also the thing that prevent people from using care. Travel time, geographical access is extremely important.
Works on the 507-bed capacity mother and baby unit at the Konfanochi Teaching Hospital has resumed after the successful implementation of the domestic debt exchange program.
And I think we also need to remember that we had an old mother and child, which has been the biggest and longest surviving white elephant in the country. Started by a champon. I say it's the biggest white elephant because it was too big to ignore. And I'm happy we have a president who had the courage not to ignore like the predecessors.
For Joy News, Nana Ojima, Kumasi.